Hi everybody, welcome back to your online pulmonary resource for pulmonary rehab. Today we're going to talk about using a spacer with your inhalers. Okay, so you're going to use these with your type of aerosol inhalers. They are meter dose inhalers, okay? And Tracy's going to tell you a little bit more about the meter dose inhalers and the spacer.
Okay, we are back to our Kareem's book again, page 34. So if you've been prescribed a inhaler, either a rescue or a maintenance medication, and that's going to be a whole nother video too, so we're just going to talk about the spacer now. If you're prescribed a meter dose inhaler, there's a couple ways you can use it. This video is going to be on use of the spacer. The spacer is huge. We have this great little photo or picture describing it, and actually I don't think you can tell, but if you use it without a spacer, you get a lot of the medication in the back of your throat. Some actually gets in the lungs, and you probably can't see it too well. There's some dots in there. Some gets in your lungs. It absolutely does. But when you use a spacer, as we'll demonstrate, it actually slows medication down. Less get in the back of your throat and more get into your lungs. So I realize when you guys see the spacers, and if you get one, they're big, they're cumbersome. People, men can't have a hard time putting it in their pocket, or women don't have room in their purse. But honestly, if you're going to waste your time doing an inhaler, you want to get as much as you can in. So let's show them the inhaler or the spacer.
You got it. Okay, let me put that down. What we'll do is I'll put up this nice close-up really quick. That way you can see how the medication enters the lungs a little bit better, okay, with the use of a spacer. So there's research that shows a larger percentage of medication gets deeper into the lungs, which means your airways will open up a little bit more. And I didn't mean to cover your face right now, Tracy. Okay, let's try these spacers out.
Okay, so when you use an inhaler, it's very, very important that you're not short of breath. When we get into rescue medication and maintenance medication, we'll actually discuss when to use the inhalers, but you have to be able to take a slow breath when you do the inhaler. So these inhalers, you have to shake up, and you can't shake. It really has to be shook up, and that's because with the inhalers now, the medicine settles, and you really want to make sure you mix it up because you really don't know what you're getting, if you're getting the stuff that makes it come out or the medicine. So you shake it.
Okay.
Very good.
What's next, Trace?
Then we're going to show you two ways. The first way, you put on one end, you put the inhaler mouthpiece in there. On the other end is going to be where your mouth goes. So now Philip has shook the inhaler. He is going to exhale. He's going to let all of his air out, or most of his air out, and then when he's ready, he's going to push on the back of the inhaler and inhale at the same time. Yeah, you can't hear our inhaler. No.
Don't want to do that.
No whistle. So that actually is a mechanism built into the spacer, so you know if you inhale too fast. So he did perfect technique, except for he inhaled too fast. And you wouldn't know that unless you have the whistle. So he'll do it again and shake it up, let his air out, and it needs to be a slow inhale. If there's a little itty bitty whistle, that's okay. You just don't want it high.
So how do I fix that, Trace? What should I do?
You inhale slower.
Inhale slower. Okay, so let me practice again. So I put my cap back on, and I'm gonna shake. And it's not this, it's shake really hard, so that medication really mixes in. Am I right?
That's exactly right.
Now this was kind of hard to push, so what I'm gonna do is I'm gonna stand, okay? And I'm going to use my thigh here, and I'm going to push down, get that medication in there. Now that the medication's in there, I'll remove my cap. So far, so good?
So far, so good. Use that little whistle. That's fine. No whistle is best. That little whistle is perfect. Okay, so the part that we missed is now he's holding his breath. So the places where you modify now is some patients can't hold their breath that long. So you're going to hear doctors say, and hold your breath for 20 seconds. We just want you to hold your breath. So some people may be able to hold it longer. Some people may not. Please just know this is where you modify. Don't get yourself more short of breath and cough afterwards or anything. Just hold your breath for a period of time that's comfortable for you. Just don't exhale it out.
And I think one of the key things that you need to remember is before you actually take that inhale, you need to make sure you exhale all of your air. That way, when you put your lips around this and take that medication in, you're also going to take some air in, and you want to get it down into the lungs. Don't just let it hold into your mouth, okay? Don't just like that, okay? Let it come all the way down into your airways, because that's where it's going to do its job, down in the airways.
Now, Philip touched on, which is a really good point, this angle is hard to push. So if you have arthritic hands or you don't have a good grip, put it on your thigh, put it on the table, push down. You have about 10 seconds. Our spacers and most spacers that are out there have a one-way valve, so the medicine stops in there. Yeah. And it's only about 10 or 15 seconds, so that's enough time to push, let your air out, and inhale.
Yeah, so if I were to blow back into this, it's not going to mess with any of the medication in here.
Nope. It's actually a little
It
flat.
comes up right up here. If I exhale into the spacer, the air will come out of the top and will not mess with any of your medication or your dose.
This, just to kind of conclude too, this spacer honestly can make a difference if your inhalers work or not. So before you say my inhalers aren't working, try it with a spacer, because you may not be getting it down deep enough into your lungs, and the spacer is just a little trick to get the medicine in there.
Well, I think that was pretty good, Tracy.
That'll do it.
I think that's it for this video here. We'll see you next time. Take care, everybody. Bye-bye.